The patient arrives at our pre-op area. An intravenous line will be started for during the procedure. The patient will get medication that's called conscious sedation. She'll be asleep and she won't experience any discomfort while she's having the vaginal egg retrieval. She'll then be escorted into our procedure room, be set up on our procedure table. Under ultrasound guidance, once the patient is asleep, we'll use a very small needle attached to our vaginal ultrasound probe, which will then enter the vagina, and under direct vision we can see it enter the ovary. Subsequently, the needle will go into each follicle and we'll watch the fluid drain from the follicle into our test tube. And as we watch on ultrasound, we can advance to obtain the fluid from every follicle that's visualized.
The physician, as he's performing his retrieval, can actually look up at the screen and assess the follicular fluid as the embryologist is identifying the egg in the fluid.
At the end of our procedure, once all of the follicles have been aspirated, anesthesia is already waking up the patient, and probably within a 10-minute time frame, they're then escorted back into our post-anesthesia area. Usually while they're still on the table, we can inform them of how many eggs were obtained, and it's nice to get a nice smile as they're very pleased with the results of today's egg retrieval. Once the patient returns to the recovery area, they'll be watched there by the nursing staff until they're discharged approximately 45 minutes to an hour later. Vaginal ultrasound retrieval hasn't changed a whole lot since the late 80s when it started as the technology to retrieve eggs. This, however, now leads to a much greater pregnancy rate once those eggs are transported into the embryology.